name is Jorge Rodriguez and I talk about olaparib for metastatic castration-resistant prostate cancer. In next, we have the definition. The definition. This pathology is an aggressive and fatal with a median survival of 36 months. It's a heterogeneous disease, but current treatments are not based on molecular stratification. The polyadenosine diphosphate ribose, the polymerase inhibitors, the PARP, are oral drugs that target mutations in the homologous recombination repair. The pathway, which are found in approximately 26% of prostate cancer patients. Next, we have take a video about this pathology.
Today I want to cover a clinical trial measuring the efficacy or the activity of an oral agent called olaparib, otherwise known as Lynparza. Lynparza is a medication that is used to treat ovarian cancer. It's already FDA approved for that purpose, but its activity in prostate cancer seems very interesting as well, especially in people with BRCA mutations. Lynparza in this trial is going to be administered to men who have become resistant to Lupron. It's called castrate-resistant. I don't like that term, but it basically means Lupron resistant. So Lupron resistance means a rising PSA with a low testosterone, and it's a serious development. Prostate cancer men with newly diagnosed with relapse disease can often go into remissions for 10 or more years just with Lupron. But when the Lupron stops working, we're looking at a very serious development. Lynparza has been shown to have activity in prostate cancer with a specific mutation called BRCA. This is a common mutation also in breast cancer. And so what's interesting is that some studies are showing Lynparza has activity in people without that mutation, people with prostate cancer without that mutation. So in this particular study, the researchers want to evaluate if adding Lynparza or olaparib to abiraterone, otherwise known as Zytiga, can improve survival and response rates. I think this is a very good place to be testing this type of a medicine. Lynparza is sort of even though it's a pill, it's got some chemotherapy type side effects. It can lower blood counts, it can cause fatigue. So it's not something that you want to use in just anybody with prostate cancer. You want to use it, since it has side effects, in a situation where it's really needed, and people that have become resistant to Lupron need everything they can get. As you probably know, there's a number of effective medicines besides abiraterone for this kind of a situation, otherwise known as Zytiga, Xtandi, Nubeqa, Erleada, Taxotere, Jevtana, there's Provenge. There's a lot of different medicines to be considered. All of them can help prolong life, but none of them cure the disease. In this particular trial, 700 plus men are going to be randomly allocated to either getting Zytiga with a sugar pill that looks like olaparib, or Zytiga plus olaparib. And then they'll follow these two groups over time and see if the group of men that are getting olaparib live longer, have higher response rates, less pain, better outcomes. For more information about this trial, you can go to the PCRI website, pcri.org. Click on the tab that says Our Services, and there'll be a drop-down menu that says Clinical Trials. And then you'll be able to get the details and the information that you need if you want to sign up for this particular study.
After seeing the video, we can talk about the applications in medicine. The applications in medicine in combination with therapies with olaparib and are more also undergoing investigation for this disease, this abbreviation, this MCRPC. The olaparib and androgen target treatments have shown synergetic effects in preclinical research. Through androgen receptor signal, and modulations of the signal, the AHR pathway can cause this effect was observed in a study that targeted in C4-2 cells a human prostatic cell lines with androgens and will be bicalutamide and enzalutamide, leading to increase the PrEP activity. As a result, the addiction of both hormonal blockage and olaparib led to lethal synergetic effects to cell culture, and this variability counts as well as volume of tumor xenograph. We can see a video about this, the applications in medicine and how the cancer of this disease can change the quality of life in the persons who have this disease.
To treat once it has spread throughout the body, but a new gene-targeting pill may soon be here to help. I'm Erin Wright with your latest health news. A new study from the UK found that the experimental drug olaparib, which was originally developed to treat women with inherited cancers, may also benefit men with advanced prostate cancer. For this study, researchers looked at 49 men with treatment-resistant advanced prostate cancer. All of these men were treated with olaparib, and of these patients, 33% responded to treatment. Of these 16 patients who responded to treatment, 14 or 88% responded well. According to the authors of this study, this trial is a milestone in cancer treatment, as it's the first to demonstrate the benefits of treatment matched to the particular genetic characteristics of a patient's cancer. Ask your doctor what new treatments may be available for your condition.
After I see this video, we talk about the pros and cons. Yes, in the pros, the person that have this disease not may we have the experience of pain or other symptoms at the stage of cancer. You may experience many different symptoms because it's different for anyone. Okay. In a recent study, we can see in the 16 or 49 patients who could be evaluated in the 33% of this study, or the 16 patients that are 14 or the 88% of the population that was studied have response to olaparib, and this is a beneficence that we can see. Well, included these 7 patients of the study of olaparib, we can see the BRCA2 loss. Yes, and the 4 or 5 persons we can see the ATM aberrations, because this medicine is we can change the effectiveness for anyone. Okay. The next point, we come to talk about the applications in medicines or Ecuador. In Ecuador, the prostate cancer is the most second common neoplasia after lung cancer. It's the leading cause of cancer incidence in the Ecuadorian population, while mortality ranked second. Yes, while the enzalutamide significantly delays the need of chemotherapy and decrease the quality of life. Okay. Some studies have found a decrease of the risk of death and the symptoms and the chemotherapy. The aim of the study was characterized for the clinical course of patients with metastatic castration-resistant of the prostate cancer, in abbreviations MACRPC. This treated with ensulatamide. In Ecuador, we can see some cases in Colombia, Brazil, and Peru. And unfortunately, the ensulatamide have a high potential to effectiveness in the Ecuadorian populations. We can see in a study the 88% of the population in Ecuadorians who live in Ecuadorians or Colombia and Peru on tropicals on the east of the territory, we can see a better quality of life in the response after this disease. Okay, in final we have the conclusions. The conclusions, we can say a man with metastatic castration-resistant prostate cancer who have this disease of the progression will receive ensulatamide or abiraterone that we can see in the previous video. We can see who have alterations in ginseng. This plays a role, important role in the repair of the medicine with a recombination with olaparib. This was associated with the longer progression, the free survival, and better measure of response, and patients reported the endpoints that either ensulatamide or abiraterone. In final, we can see at the final video that help to understand better the topic.
When my doctor told me that he could see my prostate cancer had spread to my bones, I was devastated. He called it metastatic. A cancer diagnosis is never easy to hear, but since I was already undergoing treatment, I was hopeful that I would have more time before my cancer showed up in a bone scan or CT scan. I felt like my life was spinning out of control, and I was overwhelmed with the emotional tidal wave I was feeling. At first, I couldn't get beyond the words, "not curable." My mind just stopped, and I was gripped with fear and sadness. Then I decided to get back in the driver's seat of my life and take control of my treatment decisions. Although my cancer isn't curable, I took hope in that there are new treatment options and ongoing clinical trials. These treatments didn't promise a cure, but I could prolong my life, and hopefully a clinical trial might bring a new treatment to market. At this point, it became about my family and feeling well enough to live my daily life. So I told this to my doctor.
There are treatments available for managing metastatic castrate-resistant prostate cancer, and more treatments are being researched every day. The goal of treatment is to slow or stabilize the cancer's growth and control symptoms to help you feel better and live longer. Testosterone is the main hormone that fuels the growth of cancer cells. Men who have metastatic castrate-resistant prostate cancer are already on hormone therapy, which lowers testosterone. But your doctor may offer some newer hormone therapies you take as pills that block testosterone in different ways. This therapy uses your body's immune system to fight the cancer. This is often an option for men with few or no symptoms. The most common symptom is pain. In many patients with metastatic castrate-resistant prostate cancer, the cancer has spread to their bones. Some bone-targeted therapies help prevent bone fractures and other bone-related issues that can arise. Other kinds of bone-targeted therapies, drugs called radiopharmaceuticals, give off small amounts of radiation. These drugs can target radiation to the areas where cancer cells are growing in the bones. As with many other cancers, Chemotherapy can help slow the cancer's growth and help with pain. This uses high-energy beams to target and shrink individual tumors and can ease pain when the cancer has spread to the bones.
Learning I had metastatic castrate-resistant prostate cancer was a life-changing moment. Although my doctor said he couldn't cure it, I knew I wanted to do what I could to extend my life. But I also wanted to feel good enough to play a few holes of golf or visit with my grandchildren for a good part of that extra time. There are benefits and risks to each treatment. There are also side effects, so I talked to my doctor. We crafted a treatment plan that focuses on my personal life goals and is helping me enjoy my life and manage the symptoms. Talking to my doctor and deciding on a treatment plan gave me hope. Talk to your doctor about what is right for you.
That was my English presentation about this pathology. I hope that helped about to know more about this disease and help in the future to know more with use this video like a guidelines about this disease, and see you.